Good morning. Today we are going to see about the most fascinating topic for all medicine professionals, that is ECG. And now let's begin with the basics of ECG. We are going to see three main topics today: how to place the leads, what is the meaning of P wave, QRS and T wave. In other words, how these waves are formed. And then finally we are going to see how to calculate heart rate using ECG. So first we are going to see about lead placement. We have chest leads and we have limb leads. Limb lead placement is very simple, and for that we just see this picture. In the red color is placed in the right upper limb, black is placed in the right lower limb, yellow lead in the left upper limb and green lead in the left lower limb. So it is very simple. And now we will see about the chest leads. We have 6 leads, V1 to V6 in the left sided ECG. How these leads are placed? The leads are placed in 4th intercostal space and 5th intercostal space. Be clear in that. So how to find out this 4th intercostal space? First, palpate the patient, and here you will be usually feeling an elevation which is nothing but the sternal angle. Sternal angle is the manubriosternal joint, and the space which is just adjacent to the sternal angle is the 2nd intercostal space. Now count it down from the 2nd intercostal space and you will be getting the 3rd and then the 4th. In the 4th intercostal space, in the parasternal area, that is just adjacent to the sternum, in the right side you are going to place the lead V1 and in the left side you are going to place the lead V2. And in simple words, usually this 4th intercostal space will be adjacent to the area of nipple. So always keep it as a landmark. Never place the leads above the nipple level. And next is, after V2 you are not going to place the lead V3. You are going to place the lead V4. Where are you going? So all other leads V4, V5 and V6, they are placed in the 5th intercostal space. The lead V4 is placed in the mid-clavicular line, which is a midline drawn from the middle of the clavicle. And in the 5th intercostal space, we are going to place the other 2 leads also. V5 is placed in the anterior axillary line and V6 is placed in the mid-axillary line. Are you clear up till that? So where is this lead? V3 is placed. V3 is placed in between, that is midway between the leads V2 and V4. So it is placed here in between the leads V2 and V4. We are going to place the lead V3. And this is about the limb lead and chest lead placement for left-sided ECG. Now, if you are asked to take a right-sided ECG, where are we going to place the leads? Just right-sided ECG is a mirror image of this left-sided ECG. Here, all the leads we are going to place all the leads just in the right side and in the same intercostal space. For our ease, we are not going to change this V1 and V2. We are going to place it in the same position. And in the 5th intercostal space, we are going to place the leads V4 exactly in the mid-clavicular line and V5 over the anterior axillary line and V6 in the mid-axillary line in the same 5th intercostal space. So how are we going to name these 3 leads? We are going to name the right side, and also remember, similarly V3 is placed between the lead V1 and V2, or to be simple, we can also interchange V1 and V2 also. And how we are going to name these right-sided leads? Are we going to give it the same name V4, V5 and V6? No. It is going to be R V4, R V5 and R V6. Of course, we can include R V3 also. So this is how we are going to name our right-sided leads. So now we know to take left-sided ECG and right-sided ECG. The next one is posterior ECG. For posterior ECG also, we are going to place the leads in the fifth intercostal space. And how we are going to name these leads? We are going to name these leads as V7, V8 and V9. And where are we going to place these three leads? V7 is placed in the fifth intercostal space in posterior axillary line. So we remember V6 is placed in the mid axillary line, and just behind it in the posterior axillary line we are going to place the lead V7. And now next lead is V8. Where are we going to place it? We are going to place just below the inferior angle of scapula. Next is V9. We are going to place just adjacent to the spine. So in the paraspinal area. So all these three leads are also placed in the fifth intercostal space. And we are going to place the leads V1, V2 and V3 in the same position for posterior ECG. So V1, V2 and V3 we are not going to change. They are placed in the anterior chest wall itself. Whereas these three leads are placed in the posterior aspect of chest. And this is how we get our posterior ECG. So now we are clear with three things. For left sided, we are going to place the leads V1 and V2 in the fourth intercostal space, and V4 and V5, V6 are in the fifth intercostal space, and V3 is placed midway between V2 and V4. Just we are going to place it in the right side for right sided ECG, which we label it as RV3, RV4, RV5 and RV6. And for the posterior, we are going to place it in the same fifth intercostal space. V1 and V2, V3 in the anterior chest wall, and V7, V8 and V9 are placed in the posterior chest wall in posterior axillary line, in the just below the inferior angle of scapula and in the paraspinal area. And now we have learned about the lead placement of ECG. And next we will proceed with what is the meaning of this leads. Or how we are going to get, we'll learn how we got this P wave, QRS wave and T wave. This is just a schematic diagram of heart. Just consider this as atrium and consider this as ventricle. So what is the electrical pathway in the heart? We have SA node here, we have our AV node here, we got a bundle of His, and then we got a right bundle branch and a left bundle branch. And this left bundle is divided into left anterior fascicle and a posterior fascicle. And following that, we have got Purkinje fibers, and this is the electrical pathway of the heart. This is going to bring the impulse which got automatically generated in the SA node to the ventricular wall, and we are seeing these deflections, this electrical activity of the heart is recorded in the ECG as waves. So how we are getting these waves, and what is the meaning of these waves? First, see, the electrical impulses produced automatically in SA node. For this production, there is no deflection in the ECG. Once this impulse gets out of the SA node, it now traverses the atrium, and this atrium is activated, or this atrium is depolarized. That depolarization we see in the ECG as P wave. So first wave is P wave. What does it represent? It represents atrial depolarization. So the electrical activity activity in the atrium is seen in the ECG as P wave. After reaching the AV node, there is a delay inside the AV node. That delay is seen in the ECG as PR segment. That is a isoelectric line, that is PR segment. Once the impulse comes out of this AV node, it then traverses the right bundle of His and then right bundle, left bundle. Finally, it reaches the Purkinje fibers and reaches the ventricular wall. Once it reaches the ventricular wall, after getting out the AV node, it traverses the bundle of His, then the right bundle, left bundle, and then the Purkinje fibers, and finally the ventricular wall is depolarized or activated. That ventricular wall depolarization is then seen in the ECG as QRS complex. That is QRS. After depolarization, there is a gap in between the repolarization. So that is seen as ST segment in ECG. And once it is repolarized, or once the ventricle is recovered of this electrical activity, that repolarization is seen as T wave. So this is how the waves of ECG are formed. And so I hope you understood the meaning of these waves. Okay. The third one is we are going to see how to calculate the heart rate. So we'll see it in the next session. Thank you.